Isn't it true, though, that if you have been missing teeth for a long time, or you've been in dentures for, say, 20, 30 years, you don't have enough bone to do this?
Randy, that's probably the #1 reason why people don't do it. Somebody has told them that they don't have enough bone, so they just opt out of the procedure right off the bat. And what we find commonly is that's not true. They haven't had the right evaluation by somebody who knows what they're doing.
You get patients that actually have been told by somebody else, I don't have enough bone.
Probably on a weekly basis.
Is that right?
Yes.
And you're able to do it. So what are you doing that's different?
Well, the first thing we do is, I have a lot of skill and expertise in this area. We do take 3D imaging that helps us look at the patient's amount of bone. I also have software that I tell patients, like a video game for surgeon. I can actually do the surgery on the software before I ever do it in the patient's mouth. Because if I can't do it on the software, I can't do it in their mouth. So I rehearse what I'm going to do before I do it. And so I can tell. Now, some patients don't have enough bone. That is true, but we have ways to get around that.
So you don't have to turn anybody away. There's always something you can do.
Well, here's what I tell patients, Randy. As far as treatment with dentures, there's a lot of what we call no bone solutions. So the patient can come with minimal bone, and we actually can place implants in those patients who've been told by several people, you have to have bone grafting, we got to do something with your sinuses, we got to take bone from somewhere else, because patients don't want to have 2 or 3 surgeries, they want to have 1 surgery.
Yeah.
And the truth of the matter is, in today's environment with proper dental implants, we can avoid structures and put implants in and not have to do bone grafting.
Is this what you teach other dentists? I mean, is this one of the topics you talk about? How to deal with people with very little bone?
Randy, this is the #1 topic that we talk to dentists who are trying to help denture wearers.
Does it frustrate you, by the way?
Yes.
Like when patients come in and say, but I was told I didn't have enough.
Randy, I've been teaching this for 10 years, and I can tell you that in my profession, some get it and some don't. The most of them don't have the skill set to be able to do this. Even though we've taught them how to do this, they just can't seem to get past that. But I can tell you, in our practice, it's probably the #1 thing we see patients because they've been with somebody else who told them they didn't have any bone. And I tell them that's not true. Or they've been told they have to have 8 or 12 implants. And I say, that's not true. You don't have to have an implant per tooth. You can have 4 implants
and get a full arch of teeth.
And get a full arch of teeth the same day, quickly. You don't have to wait 3 months. Sometimes they're told, okay, we got to put the implants in and we got to wait. And then they're told, after you wait, then you have to uncover them. And then you have to heal some more. Then we can put the teeth. So it's a 12-month process.
I've had guys on my show that say, Randy, this whole same day thing, I don't know. I don't believe it.
Well, Randy.
Is it just their training?
Randy, it's training. Sometimes it's attitude. Sometimes it's aptitude.
So you could do it same day?
Same day all the time. We do that with 1 tooth.
Okay.
We do it with many teeth, or a whole set of teeth on 4 implants. The patients that really benefit the most from this, Randy, believe it or not, are the ones who need 1 implant. They come in with a front tooth. That's commonly the tooth that's injured. They've fallen on the tooth, they had a bicycle accident, somebody hit them with a Frisbee in the face, the baby jumped in and knocked the tooth off, or it was an old root canal that broke off. For a patient to lose a front tooth is really a serious problem because that's right up in the front. Everybody sees...
Can you make it look real? Can you match it up?
A lot of times they go home with a tooth that looks better than the tooth they came in with. So in 2 hours, Randy, this is typically how long it takes. In 2 hours, we can take somebody's bad tooth out, put an implant in, and put a temporary tooth made of composite, white-colored material, and I can tell you, you can't tell that they lost their tooth. And for people who are busy today in business and in sales, where the public is identifying with them right away, this is a godsend that they can do this.